Doctors would be supported if they withhold futile intubations. In other words, if a ventilator won't change a patient's fate, don't use it. The hospital told the Wall Street Journal they were just re-emphasizing guidelines already in place. So lots of questions for a wonderful person named Dr. William Hazeltine. He's chair and president of Access Health International. He designed the strategy to develop the first treatment for HIV/AIDS, and last fall, he chaired the U.S.-China Health Summit in Wuhan, where this all began. And Dr. Hazeltine, thank you so much for being available to us today. One thing that's a little bit confusing that maybe you could help us understand is this question that we still don't know how contagious the virus is, if people can get reinfected. When will we be able to know more about that so that we can then plan ahead for reopening and get the economy back and on track?
Well, we know it's highly infectious, and as the days go by, we're learning it's more infectious than we thought it was, say, a month ago, even 2 weeks ago. So it is highly infectious, as infectious or maybe even slightly more than some strains of influenza. So that's the answer to your first question. You've asked a very interesting second question, which is, can you be reinfected once you have survived the infection? And that question is still open. It's open because in the case of SARS and MERS, there was evidence that people could be reinfected after they had recovered from their first infection. And certainly there's evidence in animals that animals who also have coronaviruses may be reinfected. I should say we don't know the answer yet for this virus, for the viruses causing COVID. It's possible. It may be somewhat less likely because you make a more aggressive immune response. But there are a lot of unknowns. We don't know how long the immune system protects you, even if you have cleared the virus. So there's some big questions that it's going to take some time before we have the answer. It's not time to do the studies. It's just how long it takes you to follow somebody who's been infected and recovered to see what happens to them.
Right, and it's a race against the clock, indeed. I also think that there's some confusion about masks, whether we should use them out and about. If I'm healthy today, like if I go to the grocery store, should I wear them? Take a look at even the Surgeon General and the President of the United States, both trying to grapple with this issue. Take a look.
If you're sick, wear a mask. If you have a mask and it makes you feel better, then by all means, wear it. But know that the more you touch your face, the more you put yourself at risk. And know that right now the data isn't quite there to say that there's a net benefit of individuals to the individual of wearing a mask.
We'll take a look at it for a period of time, not forever. I mean, we want our country back. We're not going to be wearing masks forever, but it could be for a short period of time. After we get back into gear, I could see something like that happening for a period of time. But I would hope it would be a very limited period of time. Doctors, they'll come back and say for the rest of our lives we have to wear masks.
And as we try to figure this out, Doctor, in your opinion, what would you recommend to people?
I think for a number of reasons, it's better to wear a mask when you go outside. First thing, it protects, if you are infected, it gives some protection for people around you. It's also a psychological effect. That is, if you're wearing a mask, you're going to be more aware of your surroundings. You'll be more aware of the danger that you can be infected or possibly infect others. And then finally, although you have to put the mask on your face, it prevents you from touching your face, which is one of the major ways you can be infected. So there's a number of reasons that we should wear masks as we go out. I think, as the president said, it's not forever, but it is now. Let me just say what's happening around the world. If you look in Austria, you can't go into a shop anymore if you're not wearing a mask. It's against the law. Also, if you look at what happened in Italy, at first people thought you were nuts if you were wearing a mask. Now they think you're nuts if you're not wearing a mask. And in China, it's more of a sign that you respect your fellow citizens. So there's a lot of reasons to recommend wearing a mask. After I've heard this recent discussion and you asked me these questions, I've ordered a lot of masks myself just now.
Well, that gives me some perspective indeed. Could I ask you one last question? And it's kind of putting you on the spot, but for somebody like you with the expertise that you have and the background that you have, what is the biggest problem you would like to see us try to solve? Like, is there anything that, not that keeps you up at night, but is there a question or a worry that you have that we should be paying attention to?
Yeah, there is. And it's called contact tracing. The way the Chinese controlled this, and Koreans, Singaporeans, and others controlled this, was by rigorous contact tracing and isolation of those who were exposed, not just those who were infected. And it wasn't only based on tests. They did it regardless of the test results because they didn't necessarily trust their test results. I had a friend, an American, who flew from Frankfurt to Shanghai. There was somebody on the plane infected. Everybody on the plane was contacted and placed for 14 days in isolation in a hotel room. They could not they could not leave their door for 14 days from time of exposure. That's how the Chinese did it. We don't do anything like that yet. We need to be more aggressive about contact tracing and mandatory isolation of people who've been in contact with those who are infected. That's what gets me up at night, because I don't want our country to go the way Italy's going. Today is worse than yesterday for Italy. They're not out of the woods yet. And even though people are staying home, the Italian authorities aren't doing the contact tracing. I'm glad you asked me that, because that actually does keep me up at night.
Well, I'm glad that I asked you that too, and maybe it'll keep me up at night too as well. Now, we'll have you back, Dr. William Hazeltine. Thank you so much. Your expertise is invaluable.
You're welcome. Thank you, Dana.
And the